Mosquitoes are more than pesky, they're also deadly. According to the CDC, 1 in 150 people will get the West Nile virus. One person has already died in South Dakota this year because of the disease. While there are some warning signs, you need to really pay attention.
Most people who have the West Nile infection don't have symptoms. I actually have some patients who get tested for West Nile and they are surprised that it shows that they had the infection in the past and they had no idea.
Ferris Massanat is an infectious disease physician with Avera Health. He says even though symptoms are less common, there are a few that show up within 2 weeks of being bitten by a virus-carrying mosquito.
Headaches, fatigue, fever, some people have rash. So the symptoms can be confused with a lot of other different infections. Even flu-like symptoms can be seen.
So how do you stay safe this time of year? The usual advice is to use bug spray with DEET and get rid of any standing water in your lawn. However, this doesn't work for everyone. Kids under 2 years old, for example, are not supposed to use DEET.
It might be safe, but we cannot claim it's definitely safe. Because it hasn't been tested that well. You just try to cover their skin as much as possible when they're outside to avoid getting bit by mosquitoes.
Right now there is no vaccine for West Nile or an effective treatment. Massanat hopes more research can begin to bring down the number of infections.
Even though it's not the worst health problem that we have, but it's still a significant health problem and it affects many parts of the country.
The risk of West Nile typically starts to drop with cooler weather. The South Dakota Health Department will update the risk level on its website each week, and we've posted a link with this story to that at KELOLAND.com.